Hello, and welcome to the Stem Cell Healing Institute podcast. In case you have any questions regarding this program, please write us at info@stemcellhealinginstitute.com. Thank you and enjoy the podcast. Hello and welcome back to the Stem Cell Healing Institute podcast. We are here with Dr. Sara Figueredo. She needs no introduction, but she's going to say hello anyways. Hello, doctor. How are you?
Very good, Luis. Thank you so much. How are you?
I'm doing great. So today we are going to be talking about autoimmune diseases. Doctor, can we mention what are the autoimmune diseases, or what is it?
Yes. What types of conditions are considered autoimmune? That's a good question.
Yeah.
So, multiple sclerosis we have treated, and multiple sclerosis, rheumatoid arthritis, scleroderma, Parkinson's disease. These are all conditions where the body there's been some sort of trigger or modification in the body's immune system, where the body
Attacks itself.
That's right. That's right. Where the body gets confused and considers its own cells as foreign, and then it creates an antibody response to your own cells, considering them as foreign. So that's basically that's correct, Louise, is where the body starts to attack itself.
So yeah, I did have a hyperthyroid issue, and that's one of the that's one of the autoimmune disease, right?
That's right. Hashimoto's, Graves' disease, Addison's disease. So yeah, there are numerous conditions where the body creates antibodies that attack its own cells. Mm-hmm.
It is proven that stem cell therapy can help with autoimmune diseases, right?
Yes. So what we do is we have a two-pronged approach with autoimmune conditions with stem cells. We're trying to not only shut off the autoimmunity and aim to stop the progression of the disease and remission, basically, hopefully a permanent remission, as well as undoing the damage that's already been done. So, for instance, with rheumatoid arthritis, the antibodies have attacked the joints of the body. So we need to sort of regenerate the cartilage and the joints to undo the pain, the damage that's already been done. With multiple sclerosis, for instance, we have the antibodies attacking the myelin sheath of the nerves, and that's what prevents the mobility in a patient and eventual, wheelchair and inability to have normal bodily functions and movements. And so we try to aim to shut off the antibodies from attacking the myelin, and then also try to regenerate the myelin. So that's the goal, and it's very, very plausible with stem cells.
Excellent. I need to ask you, how do you administer this number of stem cells? Is there like a specific number of stem cells that you use for autoimmune diseases?
Not particularly for autoimmune, but we do go by height and weight of a patient in order to administer the right amounts, and we do various different modalities of and deployments of the stem cells. So it's not only IV. So there's a certain number that we would do IV, intravenous infusion of the stem cells. We would also do lymph node injections of the stem cells, in this case with autoimmune conditions. We also do local injections. So in the case of rheumatoid arthritis, for instance, we would do these three methods of deployment: IV infusion, as well as lymph node administration, and perhaps right into the joints to have that local effect more immediately, an immediate response.
I see. And how about the treatment? Is the protocol different for each disease or the patient? I suppose age and everything, right? You have different
That's
protocols.
right.
Uh-huh.
That that's right. That's right. So yes, depending again on the patient, depending on the disease condition, we will do what's appropriate for each individual patient with a certain disease condition. Absolutely.
These treatments include also oxygen therapy. Is that correct, doctor?
Yes, yes, we do a very comprehensive approach in with our stem cell treatments. We do oxygen therapy, which is so healing for every cell of the body, as well as very rejuvenating for the stem cells, as well again for every cell of the body. We also do a total body detox program with nutritional IVs and B vitamin shots and organic coffee suppositories, proprietary suppositories that we make in our labs, as well as a stem cell enhancement formula with key herbs and minerals, and grow and age appropriate growth hormone therapy. And all of these work in conjunction with the stem cells and with the body, because the body is not just in this case we in any disease condition we want to create a milieu or an environment where the stem cells can prosper, and that would mean the cleanest, most rejuvenated, the best environment, and that is our approach so that we can have the best results with the longest lasting effects.
I see. And let's see. I'm a patient that doesn't know that I suffer an autoimmune disease. What would be the signs to identify that I do have an autoimmune disease?
Right. That's a good question, Louise. So most patients that come to us, they're usually diagnosed and already. However, there are many that have, it goes unnoticed or it's been missed. So we do a screening and blood tests before they come in order to make sure and ensure that they're good candidates for the procedure. But specifically, we go by clinical symptoms, and then and that leads us to do certain tests, and that could include the anti-nuclear antibody test, the ANA, rheumatoid factor, erythrocyte sedimentation rate, perhaps the C-reactive protein. So a combination of these give us an idea of what's going on in the body in order to perhaps diagnose an autoimmune condition.
Yes, but the symptoms will be like, what will be the symptoms that I will feel?
Oh, well, yes, so it would depend on the disease itself.
I see.
So for the rheumatoid arthritis, we may see joint pain, which is almost always bilateral, which means it's in both sides of the body. So if it's in the hand, it'll be both hands. If it's in the knees, it'll be both knees. Sort of an arthritis type of a feeling, swelling and pain in the joints. So that would be something where arthritis. Oh, another very important one to consider is lupus, SLE. Lupus has very similar symptoms with rheumatoid arthritis, and then we see rashes, hair loss, skin conditions, things like that. So these are again other signs with the thyroid, Hashimoto's, for instance. We see typical thyroid symptoms like
Oh, I can.
intolerance to cold.
Yeah, I can help you out with that. You start shaking terribly. You sweat a lot, and you're
Oh,
always
yes,
hungry.
yes,
And you go to the bathroom like four
mhm,
times a day.
yes. Did you find also weight loss? And
Oh
that's with a
yeah,
hyperthyroid.
weight
That's correct.
loss for
Uh, the-
sure.
yes, yes. And then we see sort of the opposite with a hypothyroid condition,
Exactly,
like a
exactly.
Hashimoto's. And so we see, intolerance to pain, intolerance to cold, We see hair loss, we see dry skin, we see weight gain. So those types of with thyroid conditions, low thyroid or hypothyroid, and then you mentioned very very clearly and very accurately the hyperthyroid.
Yeah, I suffer
And
with that
then
one. I'm hypo now, but I suffer with hyper.
mm,
Yeah, that was pretty
oh
bad.
yes,
And the use of stem cells can not only help autoimmune diseases, right?
right, Louise. The goal of stem cells, the reason why stem cells are so they're the present and future of medicine is that it's so regenerating. There is a capacity, if done correctly, and in the best environment of the body, we have the capacity to cure diseases, and undo the damage that disease has caused. And so, and it's about regenerating. It's about regenerating old damaged cells. It's about regenerating and rejuvenating the body. There's so much involved with stem cells, and they work at in ways that even we don't even know, and that's why the research is ongoing. And so it's there's such a potential with stem cells that I feel honored to be a part of the field and to be doing what I do.
Excellent, doctor. I'm gonna ask you one last question, or maybe two. Is the stem cell therapy safe for those that are wondering out there?
That's a very good question, Louise, because I get asked that a lot. And there's a common misconception because we only use adult mesenchymal stem cells, whether it's coming from umbilical cord or if it's coming from bone marrow derived or adipose derived or endometrial derived. These are all adult mesenchymal stem cells, which are the ultimate safety. Okay. The ones that are considered basically controversial, the potential for cancers and uncontrolled growths, the ethical and moral dilemmas these are considered with embryonic stem cells. The safety and efficacy has not been deemed because these are young, very young stem cells. They're not adult stem cells, and they have the capacity for uncontrolled growths or tumors, and so that's the scare. And we don't use those at all. We only use adult mesenchymal stem cells, so very safe and effective.
Excellent, doctor. I was wondering, have you ever done these treatments to yourself?
You know what? I don't think you've ever asked me that,
No,
Louise,
this is the first
before.
time. Yeah.
Yes, and you know what? The answer to your question is a resounding yes.
Okay.
I don't do anything to patients before testing it out on myself. Um, I will be my first guinea pig, and of course these are tried and tested even before I do it on myself. But so I know how it feels. I know how it feels to be injected with stem cells, IV infusions, lymph node injections, knee injections. Yep, I've done it all, and so it's pretty. It's nice to know that and what it feels for a patient. So it's firsthand experience. So I can describe it to my patients and be very honest in telling them that I know how it feels. So yes.
Okay. So, doctor, yeah, thank you very much for answering my questions. I don't know if you want to add something else to this podcast.
Um, I think just that we look forward to hearing from any listeners and perhaps even suggestions on what else they might like to hear. And Louise, I think you do a great job of adding the contact information to each podcast. So I
All
think
right.
that we're there.
All right. Well, I appreciate your time, doctor, and please enjoy the rest of your weekend.
Thank you so much, Louise. Will do, and same to you.
Okay. You take care.
Thank you. Bye bye.
Bye bye. you want to contact us at the Stem Cell Healing Institute or Dr. Sarah Figueredo, you may do it by calling us. In North America, you may dial +1 209 690 7836. Also, if you want to write us by WhatsApp, you may add +502 4220 7297. Please send us an email at info@stemcellhealinginstitute.com. And don't forget to visit our website, stemcellhealinginstitute.com. Also, if you like to recommend our treatments, you may find us on Facebook at Stem Cell Healing Institute. Please follow us on Instagram at StemCellHI. If you want to recommend this podcast, please refer to anchor.fm/stemcellhealing. Also, you may find us with that very same name on Spotify. If you want to watch our videos, please go to Dr. Sarah Figueredo. That is on YouTube. Thank you.